Good afternoon. Thank you for joining us here today, and thank you as well to Dr. Roussin for making time out of his schedule to join me. Today, we're here to discuss an update to public health orders. Rising case counts and COVID-19 transmission in the province means we need to introduce new measures now to reduce the impact of the fourth wave of COVID-19 in Manitoba. Case counts and hospitalizations are rising everywhere in Canada, and we must be proactive in protecting our healthcare system and ensure we have hospital beds available to continue to provide care for patients in need. To increase preparedness and address the fourth wave, the province has taken 3 key steps to help reduce COVID-19 transmission. First, we're moving to the restricted orange level on the pandemic response system. Second, we're introducing additional public health orders that expand requirements for proof of immunization for larger gatherings. And third, we're implementing new protocols to ensure additional health system capacity when needed. These new public health orders will allow fully vaccinated Manitobans to continue to enjoy as much freedom and as few restrictions as possible. Unvaccinated individuals will now be more restricted in their activities. As we enter the fourth wave, vaccines continue to be our safest protection. And I want to thank all of you, the hundreds of thousands of Manitobans who've participated in our historic vaccination efforts thus far. You did your part by rolling up your sleeve, not once, but twice, to protect yourself and your fellow Manitobans. To date, over 1.9 million vaccinations have been administered in Manitoba, and that's over 84% of Manitobans that have received at least 1 dose, and nearly 81% of Manitobans that are fully vaccinated. I'll now pass it over to Dr. Roussin to expand on the new public health orders.
Well, thank you, Minister. Brent Roussin, Manitoba's Chief Provincial Public Health Officer. So Manitoba's progress on vaccination remains one of the best in the country. As of Wednesday, 80.4% of Manitobans were fully vaccinated and 84.9% had received at least 1 dose. But case numbers, including hospitalizations and ICU admissions, have been increasing, and it's especially amongst the nearly 400,000 Manitobans that remain unvaccinated. On Wednesday, 85 of the 114 new cases were not fully immunized. That's 75%. And 100% of the cases in ICU were not fully immunized. In addition, the number of COVID-19 cases in ICU has continued to increase since the beginning of September. If we look at the estimated time for a number of cases to double in the Southern Health region, it would take less than 3 weeks if everything remains the same. So that means that region could be seeing 93 cases per day in under 3 weeks. That alone could place the province's hospital system at risk. As of September 30, there were 95 patients in ICU, 20 of them with COVID. This is an increase to ICU admissions of 17% from the week prior. A significant number of COVID admissions were not tested prior to arrival in ICU. So this is 2/3 of all COVID-19 admissions to the ICU in the previous week were first diagnosed with COVID-19 upon admission to hospital. So this tells us that non-COVID-19 care for Manitobans will be significantly affected by surges in COVID-19 activity, hospitalization, especially those demands in the ICU. This is why we need to take action now to continue to be proactive to protect Manitobans and our healthcare system. Again, any new public health orders, we need to reflect the increased risk to and from unvaccinated Manitobans. The new public health orders will allow fully vaccinated Manitobans and those that are not eligible for vaccination to continue to enjoy as much freedom and as few restrictions as possible. However, unvaccinated individuals will now be more restricted in their activities. To increase COVID-19 preparedness and address the fourth wave, this province is taking key steps to help reduce the transmission of COVID-19. So we are moving to restricted or orange on the PRS, the Pandemic Response System. The COVID-19 response level on the Pandemic Response System is being raised from caution yellow to restricted orange to reflect this increased risk. This move at this point will not affect schools. Schools will continue to remain at the yellow level so we can ensure we keep as many kids in school as possible. Public health continues to work very closely with education. We're still recommending a school-by-school approach when the risk is justified. We're also introducing additional public health orders that will expand requirements for proof of immunization and reduce gathering sizes where unvaccinated individuals are present. This includes limiting households to guests from one other household for private indoor gatherings when any unvaccinated person who is eligible to be vaccinated is present on the property. And that includes people who live at that location. For outdoor gatherings on private property, we're limiting households to 10 guests outdoors when any unvaccinated person who is eligible to be vaccinated is present on the property. And again, even if that unvaccinated person resides at that location. We're also reducing indoor public gathering group sizes to 25 people or 25% capacity, whichever is lower. And that for those that are unvaccinated, gatherings that include unvaccinated individuals. So this includes weddings and funerals. The orders will also reduce indoor group sizes for faith-based ceremonies to 25 people or 33% capacity, whichever is greater. And that's again for gatherings that include unvaccinated people who are eligible to be vaccinated. Fully immunized Manitobans and those under age 12 who are not eligible for the vaccine may gather without capacity limits in all of these areas. Household gatherings, weddings, funerals, faith-based gatherings, as well as indoor recreation can also occur for fully vaccinated individuals and those under 12 without any restrictions. Just to provide an example, faith-based gatherings may take place with a choice of services at their discretion for fully immunized worshippers, which would then be no capacity restrictions, or unvaccinated worshippers, which would have to adhere to the capacity restrictions. So gated control events and gatherings where proof of vaccine is required will continue to be permitted as per before. The public health orders will reduce all outdoor public gathering sizes to 50 people. So we've been discussing the concerning case numbers in Southern Health Region, Santé Sud Health Region. On Wednesday, there were 114 new cases in Manitoba, with 44 of those new cases in Southern Health Santé Sud. That's 38% of new cases in a region that has 15% of our population. To further put that into context, there was 25 cases on the same day in Winnipeg, which has about 4 times as many people as Southern Health has. Since August 1, there have been 50 ICU admissions. Of that, 26 or 52% have been from the Southern Health region. Many of the individuals entering ICU are only getting tested when they seek care at a hospital, which means there are many more cases that we're not diagnosing because of the lack of testing. To reduce the spread of the virus in the region, the orders will also move retail capacity to 50% in Southern Health Santé Sud region. These orders will come into effect October 5 at 12:01 a.m. There will be a 1-week grace period for weddings and funerals as in previous orders. Our data shows that vaccination works. The majority of hospitalizations and the vast majority of ICU admissions are in people who are not fully vaccinated. That's why we're drafting orders to ensure fully vaccinated Manitobans and Manitobans who are not eligible for vaccination will largely be unaffected by these new orders. Our healthcare system remains at risk from the Delta variant, and these COVID-19 case numbers and hospitalizations are rising. Today's announcements are a consequence of that reality. All Manitobans need to take these steps to protect those who are not immunized, especially children who are not eligible. We have to protect our healthcare system from increased hospitalization and ICU admissions linked to this Delta variant. So I urge the many thousands of Manitobans who have not been immunized to make an appointment today. If some of you are waiting until the proof of vaccine requirement is going to end, please consider the consequences of waiting. This COVID is not going away. It's going to be with us for years. And you're much more likely to get sick from COVID, especially severe illness, if you are not vaccinated. We know that these consequences aren't only on the individual. As we see, unvaccinated people are putting more and more strain on our healthcare system. That means it's unvaccinated people in ICU and in hospital prevents or may prevent another Manitoban from getting other medical care they need. Vaccination is a single best long-term solution to prevent further lockdowns and to keep our healthcare system available to all Manitobans. So I encourage you to book your vaccination appointment today or visit a super site for a walk-in appointment. Many different places for you to attend, super sites, pop-up clinics, physicians' offices and pharmacies. Your healthcare providers are there to answer any questions and help you through the process. Visit protectmb.ca today to find a location near you. So I'm going to turn things back to the Minister. Thank you.
Thank you, Dr. Roussin. We believe these public health orders are the best way to protect those who cannot protect themselves. And this is the best way to protect all of us through the fourth wave. Please do your part and not only get vaccinated, but continue with the fundamentals we've been talking about since last year. Stay home when you're sick, wear a mask, wash your hands regularly, and continue to physically distance. Thank you again to the more than 80% of eligible Manitobans who've been vaccinated to protect their own health and those around them. Right now, there's nearly 400,000 people who are not immunized, and they are at higher risk of infection and transmission. To keep our children in schools, to not postpone medical procedures, to keep our friends, families, and neighbors safe, please, I'm begging you to get vaccinated. We can get through this together. Thank you, and we will now take your questions.
Ms. Gordon, there's a lot new here to enforce, including in private residences. It looks like there's a vaccine passport for private residences. Is the province going to help regions like Southern Health in terms of enforcement so that it's not just left up to a small community police force?
Well, as you know, individuals across the province have a number that they can call if they feel concerned about any gatherings, and we always investigate those particular situations. But again, going back to what we have been saying in these press conferences is that we need all Manitobans to work together, hand in hand with us. We're all Manitobans, and keep us all safe by getting vaccinated.
But without additional enforcement support in areas like some parts of the Southern Health region, how is this going to be enforced? There's already a lot of reluctance in some areas.
Mm-hmm. So we are taking a whole of government approach that we do with many other ministries in terms of addressing issues. And so we will be looking to the Ministry of Justice to assist us in enforcement. As you know, the officials that do their enforcement fall under that jurisdiction. And so we are having those discussions. And again, what I'd like to say is that we need to get people vaccinated. And that is our focus. And if Manitobans have specific concerns about a gathering, they are invited to call in, and we will investigate those specific situations.
Minister, we've already heard from mayors and people of police forces and services that have said they can't do this. There's too much division, there's too much civil disobedience, they don't have the resources. I spoke to the mayor Morton yesterday, and he said if they're going to go with regional restrictions, I hope that there is specific help that is already going to be targeted. So what specific resources or money are your colleagues in Justice going to provide people specifically in Southern Health, where a lot of the population is just going to look at this and go, nah, I'm not going to do it?
Well, again, it's a whole of government approach. So it's enforcement, it's education, it's raising awareness. So we have teams on the ground in not just Southern, but in all the RHAs. They all have their specific challenges. Talking with individuals who are vaccine hesitant about why they are not getting vaccinated. And then we will continue to work with the Ministry of Justice on development of strategies to enforce, to do greater enforcement. We're going to work with the municipal officials. What works in your jurisdiction may not work in another. And so what types of solutions can we develop to assist you in terms of enforcement?
Do you agree, though, that at this point, after 10 months, it's pretty clear that the folks in Southern Health who haven't gotten their shots just aren't going to get their shots? And talking to them about their hesitancy, it's not going to work when you're trying to get people to effectively not have house parties without unvaccinated people.
Again, all the regions have their challenges. Right across the province, we're seeing different pockets of individuals who do not want to get vaccinated. Our job on the ground is to talk with those individuals, to find out why they're hesitant to get the vaccine. And then to develop those strategies, not just in terms of enforcement, but in terms of also getting the vaccine rates up. And for the jurisdictions that are saying that they're having the difficulties with enforcement, our Ministry of Justice is continuing to have discussions with them on the strategies and protocols that we can develop to address those issues.
Is it realistic to expect that somebody is going to go knocking on doors in the RM of Stanley, for example, or going up to farmhouses and making sure that everybody that is gathered there has a proof of vaccination?
Well, what I hope is that Manitobans will see the urgency of getting vaccinated and doing the right thing, and they themselves will say, these restrictions have now come forward and we are going to honor and adhere to those restrictions. That's the Manitoba that I'm accustomed to, and that's the Manitoba we live in, a Manitoba that cares about their neighbor, their families, and their friends. And so that is my hope, is that they will adhere to these restrictions on their own. And I think a lot of Manitobans have already done that, and they've shown that. And so, again, we're going to rely on Manitobans to do the right thing, follow the new public health orders. If you're not vaccinated, get vaccinated, and let's protect each other.
When it comes to enforcement in Southern Health,
question here and then we'll go to the phone.
when it comes to enforcement in Southern Health and other regions that are having lower vaccine uptake, can you name one concrete thing that's going to be different than we've been doing for the past 3 months, 4 months?
Well, one of the things that I think is concretely different is that each RHA has now identified 5 priorities for assisting individuals who are vaccine hesitant to get the vaccination. So it's the merging of the enforcement with the proactive assistance in terms of explaining to individuals about vaccines, how they protect you from COVID, and ensuring that there's that education. So education is a big part of it. There's a lot of false information out there, as Dr. Roussin has stated many times in the conferences, and we need to ensure people get the right information.
Dr. Roussin, what are the options for bringing doctors, nurses, and paramedics who are retired out of retirement to help out if things get worse?
Well, so if we're talking about the acute care system, these are questions that are better addressed to shared health. They do have multi-layered plans on addressing capacity issues. So I'd direct that specific question to shared health.
Fair enough. And in talk of protecting children, can you please speak about the risk COVID-19 places on children under 12 and reasons why they may be vaccinated?
Yeah, and so We know that children in those age groups certainly see less severe outcomes, certainly not zero risk. We certainly do see severe outcomes, especially in jurisdictions that have very high rates of transmission. So certainly there is some risk there, not as high as in other age categories, but the risk is multifaceted as well, right? These kids have endured a lot from simply being out of school. And we know that transmission chains, although in a child we don't see very many severe outcomes in children, if they're part of a transmission chain, then they bring that back to people who are at risk, which puts that strain on our healthcare system, which ultimately affects the youth as well if we have to affect their learning again.
Just a quick snapper, that 1 week grace period.
Can we go to the phone first and then we'll come back to questions after? Paul?
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CBC Radio Canada, Simon.
Hi, Dr. Roussin, Mr. Gordon. The question is just only to specify, I'd like to know if the measure announced today, how they apply to events and business that already have the protocol on to check the vaccination status.
Right. Yeah. So businesses and areas that already require proof of vaccine are unchanged by these orders. So restaurants for dine-in require proof of vaccine and then have no restrictions. That will be maintained.
And second question, so for Manitobans who are worried about another lockdown, what can you tell them right now?
Well, right now, our ability to respond to the virus has changed dramatically because of vaccine. Because we have, 80+% of the eligible population protected, now when we need public health restrictions, the vast majority of Manitobans are not heavily impacted. And so we want to avoid a lockdown, a restriction of vaccinated people who are at much less risk. So we want to avoid that as much as we can. So the best way to do this is to decrease the amount of people who are susceptible to COVID-19, which is by widespread uptake of the vaccine. And then the other is to limit the interactions amongst the unvaccinated to break up those transmission chains. So the last thing anyone wants are further lockdowns. We don't want to see business closures. Right now we can have businesses open to 80+% of eligible Manitobans. And so it's really changed the way that we can address the virus. And the more and more people getting vaccinated will allow us to, to do more and more away with these restrictions.
From CTV Winnipeg, John.
This is a question for Minister Gordon. The rising number of hospitalizations, it seems that they're largely being driven by unvaccinated people, which is threatening elective surgeries, other treatments. Do you believe the unvaccinated are letting their fellow Manitobans down by not getting vaccinated?
I believe that there's a lot of false information out in the public sphere, and what we need to do is to educate Manitobans about the urgency and the effectiveness of our vaccines and how important it is to get fully vaccinated to protect the 230,000 children I spoke about the last time I was at the press conference that are not eligible to be vaccinated. They're 12 years of age and under. The importance of getting vaccinated to keep those children in school for their mental and physical well-being, and to ensure that we assist each other as Manitobans in staying safe through this next fourth wave.
For Dr. Roussin, thank you, by the way. For Dr. Roussin, can you explain why we're seeing so many people who are waiting until they are seriously ill before they get tested for COVID, and the difficulty that makes in terms of anticipating the demand that you'll have on the healthcare system?
Yeah, and so I can't speak specifically to to choices that individuals are making. What I'd say is that when we have a significant proportion of people being admitted to ICU just tested upon admission, that means that typically those are individuals who have been ill for a week or two. So no positive case. No guidance on isolation, no contact investigation on these individuals, so that puts increasing likelihood of transmission. It also tells us that there's probably many more people who have avoided being tested, who just haven't yet presented for care, and so it really it does impact our ability to use those test positive cases to predict what our healthcare system would be looking like in a couple of weeks, because 2/3 of the people admitted are only being tested on that day. So it's very indicative that we're seeing much more transmission than our test positives are indicating.
From CHVN, Taylor.
Hi, good afternoon. How will you be sure that places of worship are collecting proof of vaccination?
Well, I mean, I think it'll be like any other aspect of it. These are, orders that are out to protect Manitobans. I think just like other businesses and probably even more, these institutions are quite concerned about the health and well-being of their parishioners. So I think they've already taken many steps for safer environments. This one here, if you do choose to use a proof of vaccine in these settings, then really capacity restrictions are lifted. So I think there's a lot of benefit to doing that. I think there's a benefit of having that option. But just like in any other sectors, it's certainly enforceable.
Thanks. And Thanksgiving is coming up. How much of an impact do you think these new orders will have on case transmission around that time?
So again, these orders are largely affecting less than 20% of eligible Manitobans, and we know that prolonged indoor gathering and we've certainly seen it in private settings increases the risk of transmission. And so if we were having large gatherings indoors with people who are unvaccinated, this is really setting us up for many transmission chains to be created and expanded. And so to limit the ability of the unvaccinated to gather with a large amount of people, the goal there is to reduce the amount of transmission chains.
From Global News, Merrick.
Hey there, Dr. Roussin. Why specifically was the 50% capacity rule on retail businesses placed in the Southern Health Region and not in other health regions across the province?
Yeah, and so we've kind of gone over the increased amount of transmission that we're seeing in that region. We're seeing increased numbers, increased test positivity, increased hospitalizations and ICU admissions from that region. So we knew that there is certainly increased risk there at this point. In addition to that, we've seen issues there with adherence to masks in indoor public places. So there's a number of reasons that we felt for that particular order we would take a regional approach. But overall, the proof of vaccine requirements are province-wide, so those do impact lower vaccinated regions more than higher vaccinated regions.
And just to follow up, could you maybe address frustration from communities like Niverville, for example, where the vaccine uptake sits near 80%, that they're being looped in with this in terms of having the same restrictions as communities with much lower vaccine uptake numbers?
Yeah, and I think it's this all relates to what a difficult time this is for all Manitobans for various reasons, right? And so certainly there's communities in the south that have good vaccine uptake, that that may feel that these orders shouldn't apply to them. We have fully vaccinated people who have had surgeries delayed because of the strains on the healthcare system. So this pandemic has caused so much harm to so many people for so many different reasons, and what we're doing is we're trying to, as best we can, limit the impact on as many Manitobans as possible. And so, of course, that's not going to be perfect, but unlike ever before, we have the ability to target more and more now because so many Manitobans are fully vaccinated.
From the Brandon Sun, Kim.
Good afternoon. Dr. Roussin, I'm just wondering, can you just clarify when will the Code Orange come into effect? Is that October the 5th as well?
Yes, I do believe that it will come into effect as these orders come into effect.
Okay, thanks. And the second question I have is, will those daily updates resume now that we're entering into a Code Orange?
I don't think we've had a decision on that. I think we'll, continue to provide updates as as frequent as we feel is required. But I don't have a specific answer on that for you.
From CJOB, Anya.
Good afternoon. I'm just wondering if you can clarify why outdoor public gatherings don't have that vaccination caveat like all the other gathering limits.
So one is the outdoor gathering. These are for unorganized outdoor public gatherings. So again, outdoors lower risk. To keep consistent with the orders, we did reduce the group sizes. There's not a lot of things that this actually applies to. A lot of organized events are proof of vaccine already, and so they won't have restrictions. So we've just decreased the group sizes. And in outdoor events that are already approved or already have proof of vaccine, those are unrestricted.
Thank you. And Madam Minister, you said the Manitoba you believe in will follow the rules, but belief is not a strategy. So what concrete steps will your government take to make sure Manitobans absolutely follow these rules?
Thank you for the question. So we will continue the enforcement that was started last year when the COVID pandemic started. So individuals who feel they have a concern about a gathering can still call in, and we will continue to investigate those specific occurrences. And again, I truly believe that the majority of Manitobans are doing the right thing. They are following the restrictions, and those who are not, we will continue to work with the Ministry of Justice to develop strategies to address those incidences where we are still seeing pockets of individuals that are not following the restrictions that come into effect, that are in effect now and come into effect next week.
We now return to the News Conference Theatre.
Dr. Roussin, given the stats out today, the Southern Health Authority continues to be overrepresented in terms of case numbers, active cases in hospital, and about more than 2/3 of active ICU cases, despite being 15% of the population. Why did you not go harder on Southern Health in terms of more regional targeting of orders?
So again, when we have restrictions that are related to proof of vaccine, then it essentially does target regions that have lower vaccine uptake. So in a way, it does target where the risk is, and so again. We've been through many things with this pandemic, and we always try to discuss the risk, where the risk is, and when we discuss where the risk is, sometimes that comes across as blaming and shaming, and it's really not about that. Like, we're concerned about our fellow Manitobans in Southern Health, right? We don't want to see 2/3 of our ICU from our fellow Manitobans in Southern Health, because there are Manitobans, and so we want that vaccine to be taken, in that area. We want these restrictions to be adhered to. because one, of course, we need to protect the health of all Manitobans, but we're concerned about our fellow Manitobans falling ill, and that's exactly what we're seeing. And it's predictable when we see low vaccine uptake in this area, but it's really such a tragedy to see that many of our Manitobans falling ill.
Dr. Roussin, we saw at the start there was a lot of retrospective criticism of the response in the second and the third wave. Right now, our overall case growth isn't anywhere near those, but we did hear about the ICU information this morning. Could you just talk about the change in approach to try to be more proactive and not making, like Dr. Gray said this morning, like not basically making the same mistakes we made in the second and third wave this time?
Yeah, I think that there's a number of things that we've learned over time. We know that in that third wave, our trajectory in Manitoba was different than other regions. We admit to ICU on a per capita basis and a per case basis significantly more than other regions. So we know that we are at significant risk. And even though we have such a great vaccine uptake, it's certainly not going to be enough, and certainly not enough when we have pockets of low vaccine uptake. So we know the risk is there. We see the risk eventualizing in other jurisdictions, and so I think we've had that opportunity to act a couple times now in a proactive way.
But knowing that, forgive me, Danielle, knowing that, we also saw some criticism of what were called like picky little restrictions before instead of more broad-based ones once we're in that exponential area. And yes, that exponential growth is really mostly in one region. But what would you say to some of the people on the infectious disease side of medicine, or maybe even epidemiologists who might see this today and go, that's great, but given that we don't expect anyone to stop having house parties in the South, like, not enough. What would you say to that criticism?
Well, I would say certainly that any of the public health restrictions are not going to be effective if they're not adhered to. So we do need to do whatever we can to get adherence to these. I think if you now look at how much vaccine uptake has changed our approach to this. If you read these orders, really, this is a very significant lockdown on the unvaccinated. If you look at how many places are actually closed to the unvaccinated, and so this is just the benefit of the vaccine, that you look at these orders and feel that they're not very restrictive, and they aren't to a vast majority of Manitobans. But to those that are not yet vaccinated, these are some of the most restrictive orders we've had.
Yes. So if this trend that we're seeing now doesn't turn in the next 2 weeks, what is the next step for public health?
We'll have to, follow what we're seeing. Like we'll have to see where the epi takes us. But really, these are quite restrictive on the unvaccinated, and so we want to do whatever we can to limit the effects of these restrictions on the vaccinated. We want to do whatever we can to keep our kids in school, and so we really need these to work. We really need the vaccine uptake to increase. We need people to adhere to these. Because our acute care system is certainly at risk, and so we need to change this trajectory now.
Given that we've seen a lot of transmission in faith-based gatherings, why not make it proof of vaccination only for faith gatherings, as opposed to having this option of capacity limits if you have some people attending who are not vaccinated?
Yeah, and I think that in these these settings are so important to so many Manitobans that that's certainly a consideration with it. We certainly did affect the capacity of it when there's unvaccinated people that are present, and then it gave that option. We want to ensure that all Manitobans at least for now can have that ability to worship in person, but as we say, we are at risk. We know that indoor prolonged gatherings are significant risk for this, so we need those fundamentals to be adhered to. We need extra caution, and we're really encouraging, and not just in the faith-based setting, but in all settings, is that proof of vaccine. This is the best way to limit those transmission chains, to allow us to keep as much open in this province to as many people in this province as possible. So, but of course, we'll have to, we're going to have to continue to see the effects of this.
But why treat it differently than a movie theater or a restaurant or a Jets game or a municipal arena? Why do faith-based settings get special consideration here? It's indoors. We know there's been a history of transmission in faith-based gatherings. Why are they being treated differently from a purely medical public health point of view?
Yeah, and so I mean, I think that there's certainly concern in a setting like that, right? Indoor, prolonged contact, and we have seen transmission there. So, I think that there's lots of reasons on the the importance of those gatherings. I think we did address some of the capacity limits, and then we put that option in, and again we're relying on Manitobans to understand the risks that we're facing. And so that proof of vaccine option, I think, will be taken up by many facilities. But we really need Manitobans to understand the risk that's ahead of us.
I have a question for the minister on a different subject. So there is a report out from the WRHA today saying that wait times in August for emergency room services increased by nearly 50% from the previous year, and also increased over the month prior. So what is happening in our ERs if patients are waiting for so long, and what's going on to address that?
Thank you for the question. So what's going on is we're in the middle of a pandemic, and we are seeing a number of individuals present into our ERs that are now COVID positive. Many of them are being tested for the first time when they enter the ERs. So there has been a great deal of challenges all across our acute care settings, and we are very committed to bringing those wait times numbers down, because wait times mean that a Manitoban is waiting for care. So we're very committed to that. We continue to look at strategies to reduce our wait times, redeployment of staff where we feel that the need is greatest, and we will continue in the months ahead, particularly during this fourth wave, to ensure that those wait times begin to come down. Even if we're inching down, we are making progress. So definitely the COVID pandemic has posed a lot of challenges in our acute care settings.
Dr. Roussin, do you do contact tracing for those who test positive for the first time once they're admitted to hospital? You had talked earlier about one of the real downsides to that is there hasn't been any contact tracing until then. There hasn't been any self-isolation. They find out for the first time that they test positive once they're at the hospital or they're sick enough to need care. And at that point, do you do contact tracing?
Yes. Yeah, we'll still do contact tracing in much the same manner. It's obviously more difficult, especially if a person's critically ill, but we'll try to work with the family and try to work that out. It could be late. We might be finding other cases that, again, we could do contact tracing on. There could be some people still in an incubation period that we would get isolated. So we definitely still do contact tracing.
And where are we standing these days on the number of contacts? Are those going up? And if so, are they going up more in Southern Health than in other regions?
They are going up over time. I believe the average is about 4 to 5 right now, but again, that has a very huge range, right? We have some that have a contact list of 50 or more. We do find in all regions there's less and less cooperation with our contact tracers, so we're not hearing about a lot of contacts. People are not being very forthcoming with places they've been. So overall, we have seen the cases, their contacts per case increase.
And I know it's early, but will you be keeping your eye on the very large gatherings we've seen now with Jets games? Bit of a test here. How well does it work? I know it's only been 3 or 4 days since the first really large one, but is that something you're keeping your eye on? And how would could you explain how would you detect whether there was some, transmission of concern there that might result in illness.
Right, yeah, and so again, I mean, it largely will require our, individuals to cooperate with our contact tracing procedure. So cases are always asked about, where they've attended during their infectious and their incubation periods. And then of course finding out where contacts were. So with things lighting up that way, if we see a number of cases that during their infectious period or incubation period we're at a certain gathering, then it starts highlighting things for us.
When you do that type of contact tracing, do you actually look at where they are sitting to see if there was transmission, and does it get down to that kind of granular?
Absolutely. If we if that information is forthcoming to us, then absolutely.
Was part of this designed so that it takes effect in advance of Thanksgiving, I see. So was part of this designed so that people who are hosting Thanksgiving get-togethers have a clear legal basis for saying no to unvaccinated relatives?
Well, I don't know if that was any specific intent. Our biggest intent is to disrupt transmission chains, and the best way to do that is to decrease the amount of gathering amongst the unvaccinated. So we wanted to put this in here. It does have that effect where people can feel more comfortable now asking for that and acting on it. But overall, the purpose of these orders is to disrupt transmission chains.
Operational question, this 1 week from today, 1 week grace period for weddings and funerals, is that from today for October 8th or from the 5th to October 12th?
That's from the 5th.
All right, thank you, folks.